Halifax Health has been training family medicine physicians since 1971. Our accreditation predates the current accreditation system.
The culture at Halifax Health Family Medicine Residency program is one that we take a lot of pride in. We care about our residents personally and professionally. Residency can be challenging at times, and we want to support our residents and encourage them during their training. We do this by placing value on the residents' goals, needs, and wellness, and by really providing a community that celebrates diversity and each member's contribution to the team.
Over the last 3 years, I've had a wonderful experience. I feel like we have learned a lot. We have a very well-rounded program where we do both obstetrics, pediatrics, inpatient medicine, outpatient medicine. It's just been able to teach me everything that I need to know, no matter where I practice.
I think if residents come to this program, they're going to be very well-rounded. They're going to have a high-volume inpatient experience with patients in the ICU, with patients who are sick. They're going to be built to quick autonomy and be able to make decisions for their own, which is going to be fantastic for their development.
We have an amazing staff, but we're given so much autonomy. At the end of my first year, I felt comfortable delivering babies. I felt comfortable providing prenatal care, neonatal care, care for the elderly. I felt very well-rounded and very comfortable even after 1 year.
We are very dedicated to having faculty here who are strong in their different areas of interest, be it obstetrics, sports medicine, geriatrics, in my case, behavioral health, and we bring that passion and that really strong teaching, and they will definitely end up with a well-rounded education if they come here.
One thing that I sought out and many of the residents sought out when they were looking for residency programs is working with underserved populations. Halifax Health is a safety net hospital. We work with all kinds of patients, and that's great for training because one day you'll have a patient who maybe has no resources at all, and then the other day you have someone who might have access to everything, but that teaches you as a physician to learn how to navigate the system.
So one of the things that's very unique about our program is that we have a strong health disparities curriculum. We are very dedicated to training our residents to work with patients of all different backgrounds, be it racial, ethnic, socioeconomic. We know that we live in an incredibly diverse country, and these days residents really want to be well prepared to work anywhere in the country with any group of people. And in addition to that, we really promote diversity and inclusion among our staff, residents, and faculty, and we feel it's really important to create a welcoming atmosphere for any resident who chooses to come and train here.
We're like a little family, and I think when you're choosing a residency program, that is the most important thing to look for, because you're going to be through 3 years of hardship and sleepless nights, and you want to make sure that you have a supportive environment and people to fall back on if you need to.
A residency program is more than just meeting the training requirements set by the ACGME and the American Board of Family Medicine. What's important is knowing you're part of a program that genuinely cares about you as a person and wants to see you succeed. It is a place where you can feel comfortable to grow and thrive. We strive to be a program that really looks to see what a resident wants for their future, what support and resources they need in order to get there, and understand how to help them individually to achieve their personal and professional goals.
There's a lot of opportunities available. You can join faculty. We have somebody that recently graduated has become faculty at our program. You can also, work as a hospitalist. We have multiple residents that are graduating and now will be working alongside the hospitalists here. And you also have a lot of outpatient experiences. We have a lot of clinics in the area and a lot of opportunities to grow and kind of, become the kind of doctor that you want to be and practice where you want to practice and how you want to practice.
Every residency is tough, but one great thing about ours is that we do have work-life balance. This is a very caring atmosphere, and I definitely think this is a program that you should look into if you want to engage in broad spectrum care, but then have the ability to kind of shape your residency program the way that you want, especially later on during your time here.
I believe that the Halifax Health Family Medicine Residency is the best in the nation. Are you ready to be the best?